and welcome to Your Health in Your Hands. I'm Dr. David Ajibade with the Brain and Body Foundation. Well, we're still in the US, and I got to tell you, the numbers are increasing astronomically. I believe last week we crossed the 350,000 mark, and experts are saying that number is going to increase exponentially. Why? Because there's been a lot of travel in the last few weeks over the Christmas. In fact, the numbers are startling. 85 million people traveled for Christmas and New Year. So think about that. 85 million people all over the United States, all going to see their relatives and friends and everything. And that same number is going to travel back. So it's not 85 million one way. So we're looking at almost 150 million traveling. That's a wonderful environment, perfect storm for super spread. And so this, we're looking at a much worse case of COVID-19 the next months ahead. And if you remember Dr. Badamasi, who is the pulmonologist we had on a couple of times, I believe he was on last week, he also was saying that his ICU beds are completely full. So please, let's not take anything for granted. And on the show today, I have the unique honor of welcoming the enemy presidents of the president of the Nigerian Medical Association, overall president, not state president, overall president. And let me quickly introduce him. His name is Professor Innocent Uja. He is a professor of obstetrics and gynecology and consultant surgeon. He is also, in addition to being the president, he is also the vice chancellor of the Federal University of Medical Science, Otukpo, Benue State. I don't know how he does it, but Prof, you are very, very welcome to the show today.
Thank you very much, and Happy New Year to you. We
Thank you,
sir.
Happy
The New Year will be better than last year.
Amen. Thank you so much, sir. So we have a lot to discuss, and with regards to COVID-19. First of all, I just would like an overview. What's your perspective of how COVID-19 is being handled in Nigeria, and especially from your own your position as the head of the Medical Association?
Well, you know and you are aware that COVID-19 came like a bang. Nobody was expecting it. Nobody was prepared for it. Not even in Europe and America. Because what we are seeing clearly is a disease that nobody knows anything about.
Right.
All we know is that it affects, has some symptoms similar to malaria, and then of course becomes much increased, infecting the respiratory system, and then spread to the whole body. And also kills. Apart from that, we do not know the epidemiology of the disease. We don't know how, right? We don't know where, we don't know when. And we are not given opportunity to prepare. So Nigeria did not prepare for this, like many other countries. However, when it came, the president took a political commitment, a political will to set up a PTF, that's the Presidential Task Force on COVID-19 prevention and containment. But I think that is the best, that is the best we had. We have people like Professor Tomori who have been there for years. Issues of yellow fever containment, issues of Ebola. I was acting co-chair. I was co-chair of Ebola treatment research group when I was Director General of Nigerian Institute of Medical Research. We trained 250 Nigerians that went to help to contain Ebola in Liberia, Sierra Leone, and Guinea. I'm not sure these people were involved. And what we are saying that there should have been a mix for effective national response. But what we saw was political composition. I'm not saying they're not doing their best, but whether their best is good enough is another thing. We need to be very, very frank with ourselves. We have capacity, we have human capacity. And I'm happy that I was told that there was a technical committee that was eventually set up by the Federal Ministry of Health, which is headed by Professor Tomori. But you need to interface with him and know that in fact nothing, little or nothing is being done by that committee. So we need to be more serious, in my opinion. I think we need more commitment, and we need to ensure that we get things up going. Those who are there, of course, are doing their own best. But we need the synergy of opinions, of ideas, of experience. I think that would have made, yes.
So, Prof, in your opinion, what specific things do you see that should be done that are not being done? In other words, what's the way forward? What specific things are clearly missing?
First of all, the research component is missing. By now, where Nigerians are saying that they don't believe that there's COVID, what have we done to find out why are they saying that there's no COVID? There's no COVID. It's a quick research question, which we can quickly answer and use that as an instrument of dissemination of information and education and sensitization. But we have no such a thing. We do not have any research component to monitor. As far as I can see, I may be wrong, but I'm yet to be told. We have not got a research component that monitors and evaluates what we are doing so that we can assess how well we are doing, what we could do better. We don't know when this COVID is going to go away. Even then, even if that's not the case, we should be able to use this as an instrument of rejigging our health system. And we will see that every day we are told that we have 1,000 people tested positive. How many tests were done? What's the denominator? It's not enough to say that you have 500 or you have 200. Now, how many tests did you do to get those so that we can get a percentage and determine the trend? That's scientific. It's not political. Right. Yes, so we are not seeing that from NCDC. And I expect that the Director General of NCDC should have come up with that. I've been shouting this for years. I mean, not for years, for months, since I became president in May. We need to have a denominator. At one point, they say the curve is flattening. How can a curve flatten when you don't even tell us the number of tests you do and the number that are positive? That's the determinant. And you calculate the percentage and draw your map and see how you can get. So what we are saying is that, yes, they are doing their best, but they could do better. Because one, the issue of non-acceptance of the fact that there's COVID, there is a lot of disinformation. We are told that we have to use the NCDC protocol. The compliance is very poor, i.e. the use of face masks, the hand washing and the use of sanitizers, social distancing, that has failed. Social distancing has failed. That's the truth. You go to marketplaces, you go to the community, nothing much is happening. And I also believe that the National Orientation Agency should do better. They should do better. The National Orientation Agency should do better. Because at the moment, the message is not going to happen. And people are just doing whatever they want to do. It's a very serious pandemic that, in fact, we are lucky, and maybe our prayers are working in Nigeria. Otherwise, they want to see dead bodies littered all over the place. I don't see dead bodies are not chicken.
Hopefully that will not happen. Hopefully that will not happen, Prof.
We have to offer.
Yes, definitely.
Because we have an opportunity. Yeah.
So, Prof, we're going to take a quick break now, a 1-minute break, and then we'll be right back. So, folks, stay tuned. All right. All right, welcome back. I'm here with Professor Uja, who is the president of the Nigerian Medical Association. And we've been talking about some of the challenges of dealing with COVID-19, the research, the government's interplay, and what needs to be done. Right now, in this segment, we want to talk about the medical doctors who are all under his purview as the president of the NMA. Prof, let's talk about the challenges. What do you see as good? What do you see needs to be improved?
Well, thank you very much. I think the first thing that is good is the commitment of the doctors, their dedication, their drive to support government to contain this pandemic as part of the national response. That's a good aspect that we can say. The doctors are very committed, and some other health workers too. They are prepared. As you know, when we started, they brought some Chinese people, very non-specific people that we do not know, And the Nigerian Medical Association kicked against it. And that was the right thing to do. Because we have the capacity, the commitment. All we need is an enabling environment. And talking about enabling environment, when we started, you recall that the issue, first of all, many of our advices were not taken. At the point when the first case came on the 27th of February 2020, the Nigerian Medical Association called the government and advised the government and advocated to the government that they needed to close borders because it was an importation, and that could have broken the transmission chain. But there was a lot of dilly-dallying until it became very obvious that they needed to close borders, and it came a little bit too little, too late. And we started. We had no. I think basically it was Lagos and Abuja that had the PCR machines for molecular testing. But the good thing is that the government responded, even if a bit late. They responded by providing many PCR machines and training the laboratory scientists and pathologists to do the test. So right now we have over 70 PCR machines, courtesy of COVID-19. But that we can't say that that's enough for Nigeria because we're a very large population. We also were faced with the inadequate supply or inconsistent supply of personal protection equipment, and it took the resident doctors, decision to go on strike, and totally unnecessary because we expected that the doctors and the government should have been on the same page. I mean, the doctors must be protected. There's no two about that. Even the patients, other patients coming to the hospitals should be protected. Doctors needed to be protected, and apart from training for infection prevention and control, they need to have the equipment. Unfortunately, it took the resident doctors, the threat, and actually took to strike action before the government responded. But I think that it's much better now. I think that planning is very, very important. We must have stakeholders meeting where we talk to ourselves and talk to the president cannot do everything. That's why he has all sorts of ministers and advisors and the rest. And they should help him. They should help him because the way the Nigerian health system is going, if we do not learn anything from COVID, then we will have failed forever. We didn't learn anything from Ebola. We ought to have learned from Ebola and use this to the advantage in the containment of COVID. But unfortunately, we have not learned anything. And if we do not document and learn from this, we would have failed. And it would have been a failed opportunity.
I think that part about documenting and learning is critical, absolutely critical, and sharing that information across not just the experts, but also across the public as well, which is what we're also trying to do with this show. Doc, on that note, we're going to take a quick break, and then we'll be right back to talk about some more things. Thank you so much. Hold on. All right, welcome back. I'm here with Professor Uja, who is the president of the Nigerian Medical Association, and we've been having a really, really good discussion on COVID-19 in Nigeria and the place doctors, house officers, resident doctors have to play in this whole issue. Thank God, Prof. Thank God we haven't had it as bad as the US, I have to say, because capacity-wise, we would have been in serious trouble. But thank God. We don't know why we are in this state, but somehow it's been good. And I know the numbers probably a little conservative compared to what is actually happening, because as you and I know, we've had several cases and reports of people having strokes and maybe not getting to the hospital in time and dying before they can be recorded. So we know that that's going on. However, it's certainly not as bad as what we had envisaged. So there's a lot to be grateful for. Let's talk about homegrown remedies. What's the research saying? What are we finding out? What can be done? What are we seeing that is effective in the treatment of COVID-19 and probably even in the prevention of COVID-19?
Well, I think it will be difficult to say to anybody that this is what we have. to ensure that we treat that cures or treats COVID-19. I think one of the things are the first, and I must be happy, must be grateful to the CMD of UCH, who first of all came out with some of the things he used when he got that steam inhalation, which I believe works. The use of azithromycin, hydroxychloroquine, zinc, vitamin C. These are the ones that we take, and of course the administration of oxygen as required. So these are some of the things we did not documented, strictly through research yet, but we will see this when they are published. But from anecdotal reports, these are some of the things that are being used. And I think when you say we are lucky, I think we must thank God, because we don't have the work capacity to respond. If it had come the way it is in the US and the UK, we wouldn't have. But in this case, this is the only pathology disease that spares Africans. Every other thing that is bad is for Africa. And you can see that within 9 months, they have hurriedly got what would look like vaccines. In fact, they say they have vaccines. It's because it's affecting them. That is response to their people. That's the responsibility they have to their people. If it were Africans like Ebola and Lassa fever, we have not got any vaccine to them because it doesn't bother them. It doesn't affect them. But we can't blame them because it's not their priority. We should take up our responsibility for our own disease and conditions. But the reality you can see now that is affecting the white people, Europe and America, they are struggling very, very hard to ensure that they get the vaccines. We have been fighting on issues of HIV for over 30-something years. We've not got the vaccine. Now, because this was killing them, they are responding appropriately. And that is the right thing to do. And we should take lessons from them, that what affects us, we should look at very seriously, not to wait for them, because their priorities are different. Our tropical disease conditions are not the same with their own, and we shouldn't wait for them. And that was why I was saying that when, and you can't fault NCDC in this case, or the PGF, when the COVID came at the beginning, we were not sure whether to use, in fact, everyone, we were not sure whether we were to use a face mask or not. We are waiting for WHO. WHO doesn't have the capacity in terms of clinical disease. They send is what people do in their various places that they put together. But eventually we were able to now say that we can use face masks. And the time lag. If we knew whether it was going to be good or not, we say, okay, our own, use face mask. Because of this, probably would have interrupted this disease, but we are waiting for WHO. And I think that is not right. We should also take into cognizance some of the capacity that we have. So the reality is that we need to document. We need to document our experiences. We need to document our failures. We need to document our successes. When we harness this, we learn for the future, because other pandemics or epidemics will come. Up to now, we have not sorted out Lassa fever. Only about 2 months ago, we had avalanche of yellow fever conditions, killing people anyhow in the southeast and in Benue. So it is something that we need to sustain the public health response to communicable diseases and emerging communicable diseases. Unfortunately, once this finishes, everybody will close doors and close shop, and that is it. Instead of now setting up a research team to continually bring out information so that we can see how well we will go. It will just, when you talk, they say there's no money there. We must invest in health. Yes, but we have not, unfortunately, you and I will not have capacity to be appointed to a place of decision. Because I know you know what to do. But you see, knowing what to do is different from doing what should be done. We don't have capacity. Like, we don't have power of enforcement. We can only advocate, we can only advise. But we know that if you put crack teams of Nigerians, whether in Europe, America, diaspora, and bring them together in Nigeria, they will do wonders.
Absolutely.
But you see, envy, jealousy, politics, all sorts of things are there. Where is this person coming from? Where is he? Who is his father? Who is that? That will not work for Nigeria. That's the truth. That's why Europe, I mean America, get the best brains. They don't care where you come from. Once you are good, they will harvest you, and you work for them, and they. I think we should learn from a country like America.
Absolutely. So, Prof, we have about 1.5 minutes left, and so we need to round up. What are your final few words that we have for Nigerians and Nigerian doctors?
Yeah, but the issue of vaccine, even we have the supply chain to keep the vaccines at minus 70 or 60 degrees. Are we ready for it? Because if we go to the bush where there's no light, the efficacy will go down. So there's so much to do. It's not enough to bring the vaccines. Yeah, you have to train people. And I think we need to go back to the drawing board and see how well we can.
I think also we need to do another session to go into depth in some of these other areas, because there's a lot to be done, especially like what you said. I think that's really valuable, that whole part of research, documentation, sharing of this information. I'm really surprised for you to say that we're not doing that. I thought we were doing that, quite frankly.
Well, I'm not aware. They may be doing it, but I'm not aware. If it's doing in the cupboard, they will not see it. Research is not done in the cupboard.
It needs to be more robust. I agree with you. Yes. Professor Uja, thank you so much, sir, for taking the time to educate us on what's going on. We hope we can get you on later. And thank you for your continual work of service to our doctors and to our nation. God bless her. Stay safe, please. Stay safe. We need you. And folks, thank you, sir.
Thank you very much, and Happy New Year again. Let 2021 be a better year than the disaster of 2020.
Indeed. Thank you. So, folks, thanks for joining us. Remember, your health is in your hands. The more education you have, the more information you have, the better equipped you will be to take charge of your health.